May is Lupus Awareness Month, and today we'll get to learn more about this chronic autoimmune disease with my first guest. Joining me now is the president and CEO of the Lupus Foundation of America, Florida chapter, Amy Yalden. Hi, Amy, and welcome to the show.
Thank you so much for having me. I appreciate you having us on to talk about lupus and raise awareness this month.
Yes, ma'am. I'm very happy to have you. Let's go ahead and start with just a little overview of what is lupus.
Sure. So lupus is a disease in where your own immune system doesn't function properly and it attacks normal, healthy tissues. So in a normal, healthy person, when they get a cold, their body immune system attacks the cold and gets rid of it. And with someone with lupus, the body may think that the skin, the joints, their own blood, the kidneys, heart, or any organ is the enemy and attacks it. So it's attacking its own healthy tissue.
Okay. And how many people in the U.S. suffer from lupus?
1.5 million people in the U.S., so which is equivalent to about 1 in 100. Every 1 in 185 people have the disease. Wow.
And do we see lupus more in a certain gender or a certain race?
Sure.
Yeah.
Sure. So research shows now it's 90% of the cases are in women, 10% in men. And oftentimes men have it more severe. They have a lot more kidney involvement, but we are seeing a rise in that. And then African Americans and Native Americans, Asians, and Hispanics have it 3 or 4 times. It's more prevalent in those areas.
Right. Now, some people have various redness and rashes on their skin. For example, the classic butterfly rash. Can you explain lupus's effect on the skin?
Sure. So good for you for knowing what the butterfly rash, and really that's one of the only outward signs that someone may have the disease. So there's a couple types of lupus, and one is systemic, which is the most common type of lupus, and that's the one that lupus may attack any of the organs. And then there's something called cutaneous and discoid, and that's where lupus only attacks the skin. And oftentimes it looks, why they call it the butterfly rash, because it comes across your nose and on your cheeks, and it looks like a butterfly. And really that can happen from even the sunlight, fluorescent lighting in someone's office or at the grocery store, or stress. But 1 in 10 people with discoid lupus could eventually develop systemic lupus. But then other times they just have discoid. But systemic is the most common type of lupus.
Okay. And is it contagious?
It is absolutely not contagious. No more contagious than cancer would be. And that's often a misconception, is people think that you can catch lupus. You cannot.
Well, I was asking particularly when you see the rash, people might.
Oh, absolutely not. Again, that's the body attacking itself. Right. So it's not something they're getting from outside that they're giving, but it's the body attacking its own skin. Okay, it thinks the skin is the enemy.
Right. So we talked about the effect on the skin. What are the other symptoms of lupus?
Sure. So the thing about lupus, it can mimic other diseases. So some of the symptoms are maybe an unexplained fever, extreme fatigue, painful sore joints, that rash that you just talked about, chest pain when you're breathing, unusual hair loss. Some people get what's called Raynaud's phenomenon, which is pale or purple fingers or toes, sensitivity to the sun, some swelling in legs, swollen glands. But again, they come and go, and they range from mild to severe, and it can look like many different other diseases. That's why lupus is so hard to diagnose. It takes an average of 3 to 4 years from 5 to 6 physicians to be diagnosed. And we're working on raising awareness and coming on programs like yours and talking to the public about what it is to hopefully get people diagnosed sooner before the disease can really do damage to the body that may be irreversible.
Right. So how do you diagnose it? Are there specific tests for it?
So there is a blood test, but there's not one specific test that says you check off a box and you have it. The American College of Rheumatology has a criteria, and if you meet 4 of the 11 criteria, then a diagnosis of lupus is likely. But again, you have to talk to your primary care physician, go to a rheumatologist. It's a physical exam, and it's talking about your symptoms. And it's important for people, if they have any of these symptoms, to start writing it down and having those discussions with your primary and then eventually a rheumatologist.
Okay. Now, what are the treatment options? You said this is a long, drawn-out, chronic situation most of the times. What can they do for you?
Sure. So unfortunately for lupus, there is no cure. And so the disease is either in remission, where the disease is not active, or it's in flare, which means that the disease is active. And so the goal is to get it in remission. And it's treated, we've only had one specific treatment option that was developed for lupus, and that was in 2011. Other drugs that are used are steroids like prednisone, things that have been anti-malarial drugs, anti-inflammatory drugs, immunosuppressants for those that may have kidney issues and involvement. And a lot of patients are on chemotherapy and biologics, a lot like what cancer patients are on. Some of them are similar to what cancer patients are using, but chemotherapy and biologics are used to monoclonal antibodies are used to treat the disease as well.
Okay.
That's why we're working so hard to fund research, because there's just not enough treatment options.
Sure.
And until we get that cure, our folks need more treatment options.
Right. Now, like I said in the beginning, May is Lupus Awareness Month. Can you talk a little bit about that? And can you talk about a little bit about the Lupus Foundation of America, the Florida chapter, and what kind of work you guys are doing?
Sure. Thank you so much. So during the month of May, Lupus Awareness Month, our organization really works to urge the public to get to know lupus and join the nationwide effort to raise awareness and funds to create a world where we don't have to have lupus. So it's our No Lupus campaign, and we really highlight that NO in it. Because research shows that nearly two-thirds of the public really knows little or nothing about lupus outside of the name. So we feel that really work hard during the month of May to increase public awareness and understanding of it. And it's critical so that we can expand our resources and funding for lupus research, because, again, we just don't have enough treatment options. The color for Lupus Awareness Month is purple, and happy to say that Florida holds the national record for the most amount of landmarks lighting up purple during the month. And, in fact, in Tampa, the SunTrust Financial Center will be lighting up purple on Put on Purple Day on May 20th. And
Excellent.
On that day, we ask everyone across the nation to wear purple and share it on their social media with the hashtag Put on Purple. And we have a contest when people send their pictures to us. And we have events across the state, from walks to seminars to teleconference. And so during the month, we have a lot of restaurants that are having events, in stores that are doing things, and storefronts that are lighting up and decorating. But if we can get your listeners on May 20th to put on purple and send us an email and share it on social media, it really does a lot to help us raise awareness. And what we do throughout the year is we provide support and services to the 100,000 plus Floridians living with lupus and their loved ones. We have a toll-free helpline, a patient navigator, an award-winning website full of information and resources, as well as free programs and materials. And we work all year long to raise money to support research, to advance the science of lupus. And we advocate for our patients for more treatment options and better healthcare options and copay assistance. And we work on tackling this disease on all fronts. And we do that we have a small staff, so we depend on our volunteers and advocates and those living with lupus and their families to really speak up and demand more for this disease.
Excellent. Now, if somebody wants to learn more about lupus or the Lupus Foundation of America, where can they go?
Sure, and they can visit our website at www.lupusfl.org. That's LUPUSFL.org. Or they can call us at 855-955-LUPUS.
Excellent. All right. Well, thank you, Amy Yalden, for your time and expertise, and keep up the great work you and your staff are doing.
Thank you so much for helping us raise awareness. We really appreciate it.